Okay. All right. Hello, everyone, and thank you for joining us here today. I'm Alex Azar, the United States Secretary of Health and Human Services. I wanted to begin by thanking the government of the Democratic Republic of the Congo and the World Health Organization for co-hosting the meeting we all just attended, a meeting of regional ministers of health on Ebola preparedness and response. The DRC President Tshisekedi and Director General Tedros have played an important role focusing the response to this outbreak. I'm very grateful for His Excellency President Tshisekedi's presence at the meeting this morning, and I thank you, Director General Tedros, for your presence here today. I also want to thank all of the ministers of health we had in attendance, as well as the United Nations, the World Bank, the United Kingdom, and the European Union for participating in this vital meeting. I wish we did not have to have this meeting, which brought together important stakeholders more than 1 year after the outbreak in the DRC began. It is necessary, however, because the unique circumstances of the eastern DRC, with civil unrest and such close proximity to international borders, have made it the most complex Ebola outbreak in history. This outbreak cannot be stopped without close and committed cooperation among all stakeholders. The nations in the region, partner nations from around the world, the UN and the WHO, and non-governmental partners like NGOs, faith communities, and industry. Thankfully, today's meeting underscored that we do have that kind of ongoing cooperation. I find the committed attitudes of my fellow ministers incredibly encouraging, in fact. Today's meeting should send a powerful message that the ministers of health here today will work together closely and relentlessly until this outbreak is over. That commitment is on display to the world today, but I also saw it on the ground last week during a trip to the DRC, Rwanda, and Uganda. In Kinshasa, I met with President Tshisekedi and Minister Longondo, in addition to other DRC leaders like Professor Jean-Jacques Muyembe of the INRB, the DRC's biomedical research institution, and a globally important leader in Ebola therapeutics. I also had the chance to visit the Ebola patients and community health workers in the eastern DRC. Meeting people who have survived this disease, restored to health by the commitment of brave health workers and novel therapeutics, was a moving experience. Finally, my trip also included visits with President Kagame and Minister Gashumba in Rwanda, and President Museveni and Minister Acheng in Uganda, where I was able to thank them for their work in securing their own nations against this Ebola outbreak. Cross-border cooperation was an important topic of discussion today, as was the continuation of the United States provision of financing, personnel deployments, technical assistance, and support for researching, manufacturing, and purchasing therapeutics and vaccines. This work is one of the top global health priorities for President Trump, and it will remain so until the outbreak is ended. We've got many nations represented here today because diseases like Ebola know no boundaries. But with cooperation like we had here today, and when we focus organizations like the WHO and the UN on these infectious threats, we can have real success in containing diseases and saving lives. Together we can stop this Ebola outbreak, work with the DRC to strengthen their health system, and build a stronger foundation for preventing such outbreaks in the future. Thank you for your attention today, and I will now hand things over to Minister Longondo.
Merci beaucoup. Je vais parler en français. Nous voudrions d'abord commencer par remercier le gouvernement américain pour l'accompagnement qu'il est en train de faire par rapport à la lutte contre Ebola, et aussi les partenaires qui sont au niveau des Nations Unies et d'autres pays du monde, l'Angleterre et la France et d'autres pays, le Japon, ainsi de suite. Mais nous voudrions vous dire aujourd'hui que nous avons un nouveau gouvernement au niveau du pays, et ce gouvernement est très engagé dans la lutte contre Ebola. La preuve en est que mon premier voyage que j'ai fait, parce que je venais d'être nommé il y a que quelques jours, et le premier voyage, c'était à Goma pour évaluer la situation. Et je suis allé aussi au Rwanda pour parler avec ma collègue. Alors, nous avons évalué la situation, et aussi, nous avons, ce qui est plus important, nous avons lancé le 4e plan stratégique pour la lutte contre cette maladie. Et nous pensons qu'avec le secrétariat technique qui venait d'être nommé par le président de la République, parce que c'est lui-même aussi à son niveau qui a pris des choses en main pour essayer de s'imprégner dans la lutte. Et maintenant, nous avons des résultats. Et chaque jour, nous ne faisons qu'assister à une baisse d'incidence et de mortalité liée à Ebola. Donc, comme engagement aussi au niveau du gouvernement, nous finançons nous-mêmes ce secrétariat, en dehors de ce que nous recevons de partenaires de la Banque mondiale et des autres pays. Le Congo finance lui-même le secrétariat. Il y a eu un premier fonds qui est déjà engagé, et puis il y aura un deuxième, et puis il y aura un troisième. Donc nous prenons cette lutte au sérieux, et le gouvernement actuel est très engagé pour combattre Ebola et l'éliminer comme urgence. Aussi, nous sommes très engagés pour mettre en place un système qui va faire en sorte que toutes les communautés puissent être préparées à prévenir cette épidémie. Donc nous allons, avec nos moyens, renforcer le système, pas seulement à l'est du pays, mais aussi dans toutes les zones de santé, tout simplement parce que Ebola, on a l'impression que cette épidémie est migratoire. Ça a commencé à l'Équateur, et puis Bandundu, et maintenant c'est à l'est du pays. Et nous ne savons pas où prochainement ça va frapper. Donc nous prenons cette épidémie au sérieux, et nous allons renforcer le système pour qu'on soit capable de lutter et prévenir cette épidémie dans l'avenir. Une fois de plus, merci beaucoup.
Dr. Tedros, did you have anything you wanted to say before we take questions?
Just a couple. As you know, the Ebola situation is on the decline. But in our meeting, we have also stressed that it's not over until it's over, because the outbreak is happening in a complex situation where there is political instability and also insecurity. And then the other issue I'd like to add is especially on regional preparedness. While fighting Ebola in DRC, we have to strengthen our preparedness in the neighboring countries because the risk of spread is still high. And we have agreed to invest in preparedness in the neighboring countries, not only to prepare for this Ebola, but for the future too, in order to prevent similar outbreaks. And in DRC, we will follow the same approach. While fighting Ebola, we will strengthen the health system, because that's what will give us a better outcome for the future too. So while fighting Ebola today, both in DRC and neighborhood, we will strengthen the health system, and that's the commitment that was shown from the countries that have participated and the partners that have participated during today's meeting. Thank you.
Thank you, Dr. Tedros. If there are any questions, we'd be happy to take some. Yes?
Yeah, Dr. Tedros, would you like to comment on the MSF allegations that the WHO is rationing? If you have anything to add to those, they're rationing the vaccine and not doing enough to get it out quick enough. Do you have anything to add to that?
They're part of the coordination, MSF, and they can raise the issues in that coordination mechanism. And we have all the partners actually involved, because without the participation of partners, we will not defeat this outbreak. So there is no rushing, or there is nothing that they don't know about.
Is there perhaps sorry, I should have introduced myself. I'm with AFP. Is there perhaps a difference in your approach and the way that they want to? I understand they want to go village to village, whereas you're using a more kind of tested formula in terms of vaccination efforts. Can you speak to those differences of what they want to do versus what you want to do?
You know, in this response, one thing we are doing is, since the situation is really complex, we learn almost every day, and we adjust our response accordingly. So for if they're recommending this, that's what we have been doing, and we will continue to do, because we have to adapt based on the condition. And as I said, because it's a complex situation.
Yes?
Dr. Tedros, Health Policy Watch from Geneva. Do you have any estimated date when you think this could be over with? And I know you've worked very, very hard to engage the communities. You're also deploying a second vaccine now, the Johnson & Johnson one, or the government is deploying that. what else do you have in your bag of tricks that you can pull out, or do you just need to intensify the efforts that you've already been making on these two fronts?
On prediction, I think it's not a good idea because, as I said earlier, it's a very complex area. We see positive developments now. The virus is on the retreat. But I said it's not over unless it's over, because there is insecurity in the area, there are a dozen of armed groups operating, and also there is political instability in that area. So any attack can actually influence the gains we have already made. So it's very difficult to predict by when we will finish, but we're sure about one thing. We will give it our best, and we will do everything to finish it as soon as possible.
What about tactics? What about the strategies that you've employed? Can you sum up what you're going to try and do next to amplify your response and really wipe this out?
Constant learning, be it on use of vaccines, on other strategies that we follow. We try to learn every day and recalibrate our response on regular basis. And this will be, of course, after the action, we will analyze or assess or evaluate it properly, and we will learn from what we have done well and where we have failed, and then prepare continuously.
I think it's also important to recognize, as Minister Longondo said, under the strong leadership and commitment of President Tshisekedi and Minister Longondo and Professor Muyembe, the Democratic Republic of the Congo leads this response effort and has a strategy. The World Health Organization, the CDC, the rest of the United States government, our NGO partners, MONUSCO, other partners throughout the world. We are here to assist, to support, to be the pillars underneath their response. But the minister, the professor, their team, under the president's direction, will lead this effort.
And that's central. The president has already been to the field to visit, to see for himself in Butembo. That shows commitment. And also he established a presidential commission and also an interministerial committee and special coordination. And all the response, as he had said, is led by the government. And all the other responders, be it WHO, UNICEF, others, are actually there to support the government's effort. And it's the government's leadership which we see, and the community ownership that will bring as result. So I fully agree, and that's how we should we can defeat this outbreak.
On Tanzania, on Tanzania, do you feel that they're sharing enough information at this point, or do you have anything to add on that?
I think we had already issued the statement on 21st September, so that is, I think, the latest that we have.
Okay. Any other questions? Oh, just one last, and then we'll be done. One last.
Thank you. I'm Amy Lieberman with DevX. I was hoping you could outline a bit more your vaccination program, where you wanted to head, what targets you have for it, and some of the challenges that you are facing or expect you might face in reaching all the people who could be impacted by this.
Would maybe Professor Muyembe? Elle a demandé avec la vaccination, les stratégies pour quelle est la stratégie pour vaccination?
Okay, so I will answer in French. It is good for you. Okay, so the strategy we have. Firstly, we have the vaccine we have is the RVSV, the above. It is the vaccine produced by Merck. So this vaccine is used to vaccinate, to immunize people who are in contact with a positive case, with a confirmed case. So to prevent the expansion of the spreading of the virus in the community. So we will vaccinate contact of the first case and the contact of the contacts. And also, we vaccinate the healthcare workers in the hospital setting and so on, and also pregnant women and lactating women and children less than 1 year old. Yes. And now I think in case of we have some problem to access in some areas, we can vaccinate also all the population in a village, for example, to have a geographic vaccination. And the second is we are thinking to use also a second vaccine, a preventive vaccine, like Johnson & Johnson vaccine, to create a kind of curtain of immunized population between the infected areas and the zone that are not yet infected. So this is our strategies.
Okay. Thank you, Professor. Okay. Thank you all very much. Appreciate you being here today.
Thank you.
Minister?